Hey there, YouTube family. So I'm back doing another video. Wanted to do an update video on just a few things. Today specifically, I'm going to be talking about aftercare post-surgery when it comes to using gauze. So today we have a couple here. I prefer the Band-Aid brand. You can use any brand you like. This is just my brand of preference. I'm not being sponsored by them. There's no monetary affiliation with any of the products I use. These are, I purchased them with my own money, and these are my own true reviews on the products, as well as what I use in regards to post-surgery care for any surgery for that matter, but specifically anal fissure or a hemorrhoidectomy. So what I wanted to do was just talk a little bit about each of the different ones here. Now, this particular one here is the Band-Aid brand non-stick pads, hurt-free. They are, comes 10 pads in a box, and they are 3 inches by 4 inches long. So it's almost like a rectangular shape. But again, these are the non-stick. Now, for this one, I just used this one at the beginning of my surgery for my second hemorrhoidectomy surgery I had, which was on June the 25th. And it was my first time using these. I thought they'd be better because they're non-stick, so this way they're not sticking back there. And they do work fairly well. But I personally only liked using them for like the first maybe 5 days post-surgery, maybe 6, just because I felt like they got to be a little uncomfortable. So as you're healing, and you're going to constantly be changing these out every time you have a bowel movement or have to go take a sitz bath, you want to replace it with a fresh gauze so you don't get any kind of bacterial buildup, infections, and to help keep that area as clean as possible. So I just wanted to kind of show you what it looked like. I'll try to get it up on the camera there if you can see. It's kind of got a smooth surface to it. It is closed off, so don't try to peel it open. When I first tried it, I thought this part you were supposed to peel it open to get to the gauze on the inside. Wasn't really thinking at that point, and ended up destroying the first one, so it ended up in the trash. But anyways, these are the gauzes. They are non-stick. Basically what you want to do is, at least what I did, is I fold them in half, like so. So you just take them, fold them in half, like such, and then just stick it between the cheeks there. Make sure it's placed in there well and in the right spot, and you just leave it there, and that's it. Now again, they are going to absorb through here. Remember, it is a surgery that you're having. It is going to take time to heal from. It is a process. You will also, after surgery, probably notice some odor back there as you're changing these out. That is normal. But again, you want to try to keep that area as clean as possible. And when I mean clean as possible, that doesn't mean scrubbing back there with soap and water and stuff, because again, you just had a surgery back there. You don't want to tear anything back there. Plus the soap may irritate or sting, and you will regret it. So what you're going to want to use is a bidet, something like this that has one of these kind of tips on it, where it's easy if you have to do it yourself, or unless you have help, great, that's awesome. But if not, for most of us, something like this, if you don't have that help or don't want the additional help and like your privacy while you're going through this, something with that bent tip works really well. I got that one on Amazon for $10. It's the portable bidet. Again, I am not sponsored by any of these products. I am not getting any monetary compensation. Everything I purchase is out of my own money. So again, this will help with keeping the area clean after having bowel movements, and as you transition into a sitz bath, whether you're doing it in an actual bathtub like I do, or if you have a sitz bath that goes over your toilet. So back to the gauze. I used these for probably like the first 5 or 6 days, and then I felt that after folding it like such and putting it back there, it just felt a little thick and bulky and a little uncomfortable, especially when you're trying to sit down. So again, these are great. I do recommend them, but I recommend them the first 5 to 6 days, first week, whatever you want to call it, before transitioning, okay? Then we have these here. Now these here are also Band-Aid brand. These are not the non-stick. This particular one here is the 3" by 3". Now, after the first 5 or 6 days of using this one, you want to transition into this type of gauze, or at least is what I would recommend and what I do. There is a size up from this, which is the next one you want to use, which is the 4" by 4". So it's bigger than this box, okay? So you want to go from having this one the first 5 or 6 days, then after the 5 or 6 days, you want to go into the 4" by 4" box of this Band-Aid brand gauze. And you want to use the 4" by 4" for at least maybe, I'd say, 3 weeks after this one. So basically the first month will be 1 week with this one, if you want to look at it that way, and 3 weeks with the 4" by 4" gauze that's like this. After you reach that first 30 days, then you may want to transition into this one, which is basically the same exact thing, but this one is a 3" by 3". It's a little bit smaller, okay? So I'm going to show you what this looks like. It's exactly the same for the 4" by 4". It's just a little bit bigger of a square. And what I would recommend doing for comfort, because again, you are going to be in some discomfort. It's not going to be fun, but it's what you're going to have to go through, and don't expect a super speedy recovery that 2 weeks, 3 weeks out, 4 weeks out, you're going to go ham doing all kinds of crazy stuff and activities and eating whatever you want. You want to take this easy, otherwise you're going to be right back in the same boat all over again if you re-injure yourself or cause any additional problems back there. But anyways, basically the 4" by 4" will look just like this. It's like a square, but it has like a crease. It folds out there. It's just a bigger square, and that would be the 4" by 4". This one again here is the 3" by 3". So 1 week with this one, the non-stick, 3 weeks with the 4" by 4". Then after that, continue with the 3" by 3", which is this one. Now what you're going to want to do, which will help double your the amount of product you get out of the boxes, at least for the 4" by 4" and this one. Don't do it with the non-stick, only with the other two. Is what I do is I take this and I unfold it. You'll see the crease there, and on the other end I'll just take a scissor like such and just cut it right down the crease in half. Now just hold it to keep it, you know, from getting all jagged and messed up. And I'm just going to basically cut them into 2 equal pieces, okay? If you saw how I did that. And now basically out of one package like this, whether it's the 4" by 4" or whether it's the 3" by 3", you're getting 2 out of 1. And it's also going to make it a little more comfortable when you're keeping this back there as you're sitting down and stuff, because if it's really thick and bulky, it's going to feel uncomfortable. So again, with this one, you're just going to go ahead and fold it in half. It should fold over easy. If you fold it this way, you may find it a little challenging folding it in one direction, but if you fold it in the other way, it'll fold over nice and easy, like such. And that's what you're going to do. You're just going to fold it in half like such, and again, place it comfortably between the cheeks back there. Make sure you have it in a good spot and that it's lined up correctly, and you just leave it there, and that's it. And that's basically it with the gauze. And as far as once you get to after the first month and you're using the 3 by 3s, everybody is different in their healing, okay? I'm currently 43 days post-op surgery from my second hemorrhoidectomy surgery, which I had on June 25th, 2021, okay? Today is currently August the 8th, I believe, 2021. So I'm 43 days post-op. I am at the point where I think I'm only going to need to use the gauze for maybe another couple more days, like maybe 3 or 4 more days, or until this box is almost done, because this is my actual last box that I have of this, and it looks like I have about 6 left in there, which would really be 12 because I cut them in half. So this should be more than sufficient, but I expect to only have to use this for maybe a couple more days, and then I should be good. Now, everybody is different. You may have to continue to use them. You may be able to stop it sooner. And the reason I like to make sure that I'm not having either none or next to no discharge back there is, one, you don't want to have any odor. Two, if you are working or doing any kind of activity, as you're moving around and sweating, that's going to rub together. That could cause any kind of discomfort. It could cause irritation, rash, it could bacterial buildup, which could cause an infection, all kinds of things. So basically, I want to make sure that I'm really not having any discharge at all, or really like next to nothing. So as you start doing this, you're going to notice at the beginning, obviously you're going to have discharge and blood and everything else. As time goes on each week, it's going to get a little bit less and a little bit less as you take these gauzes out. You'll notice that only maybe as each ring where it's at, where it's discharging, may get a little bit smaller, a little bit smaller. I want to get it to where there's really nothing on here. So when I pull these out and I have to use the restroom or anything, or take a sitz bath or whatever I need to do, that there is no discharge on here, that it's pretty much, you know, clean, so to speak, as far as discharge goes. You know, so that's why I'm using it this long. On my first 2 surgeries I had back in November and December of 2020, I had to use these gauzes a little bit longer. I would say it was probably almost 2.5 months, maybe close to 3 months I was using these. But then again, I did have 2 surgeries that were 3 weeks apart from each other in the same area. One for anal fissure and the other one for my first hemorrhoidectomy. So this last one was just a hemorrhoidectomy by itself, which was on June 25th again, and we're currently August 8th. So I don't know if that's why the discharge is not so bad, that it's kind of a little bit less further out. But I want to make sure that you guys fully understand that it is going to take time to heal from these surgeries. It is not overnight. You don't want to rush it. You're not going to feel 100% yourself. Even from time to time when I'm sitting on my couch just relaxing, and especially if you have any kind of metal components like automatic recliners, anything like that that's underneath your couches, or if you're just sitting down, or even just sitting in different positions, every once in a while I'll feel something back there that'll just make me have to reposition myself or take a little pressure off. You know, and that's kind of normal, but just remember, you're going to go through that for a little while. So don't freak out too much. Don't expect miracles that you're going to heal within 2 weeks, 3 weeks, overnight. You know, some things you'll be able to do more and more as the days go by, but don't expect to heal overnight. Don't expect this to be an overnight process. I still do the sitz baths. I'm just starting, as of like 2 days ago, trying to wean myself off a little bit from it after each bowel movement and starting to wipe. Now, as far as wiping, when you're going to take a bowel movement, and I want to try to make this a quick video, I don't want to extend it out too long, but when you're having a bowel movement, after your bowel movement, don't wipe, especially at the very beginning, the first like 30 days or so, or a little after. I wouldn't suggest wiping. You can tear something back there. You can, you may not clean it full enough. You may feel pain or discomfort. Use the bidet for that. When you get to the point after 30 days, that if you feel like you're ready, and only you know your own body, it's different for everybody. For me, it took up to maybe the 40-day mark. You, it may be 30 days, it could be longer. It depends on you and your body and how you're taking care of yourself. But once you get to that point where you think you can start wiping again, one, if you're going to use wet wipes, get the one with the non-fragrance. The fragrance will irritate, cause pain, could cause stinging, all kinds of stuff like that. So don't get anything that has fragrance. Get fragrance free if you're going to use wet wipes. I actually prefer using regular drinking water that I just pour in here, and use one of these spray bottles, and I just get my toilet paper, I spray a little bit on the toilet paper, just enough to dampen it, fold it in half, and then I blot, kind of tap back there. I don't wipe, so to speak, and once I start wiping, I do it very slowly and gently. Don't go ham on it, otherwise you're gonna regret it. So, you know, start off slow and then you build up your tolerance that way to where you feel like you're comfortable enough that maybe you don't need to dampen your toilet paper, or you don't need the bidet anymore, or you don't need to do the sitz baths. It is gonna take time. So expect this at least, the expectation for me is 2 months after surgery to feel like you're pretty much back to yourself, comfortable enough to go to the bathroom, comfortable enough to not have to do the sitz baths anymore, comfortable enough to, you know, not have to worry so much when you're out and about. So that's kind of my personal timeline, but yours may be different. So you have to judge that yourself. Again, this video is basically to just let you know how to use these gauzes after surgery and for how long, what to expect. The purpose of it, again, is to keep the area clean, you know, prevent some odor, you know, prevent also like staining or messing up your clothing back there, and as well as preventing any kind of bacterial infection buildup or sweat that this stuff can absorb it. And once you get to that point where, you know, you're pulling these out and you don't see really nothing on here, you're pretty much good to go at that point. You know, that's pretty much what I would suggest. Like I said, I'm currently 43 days post-op, and I'm at the point where I probably only need to use these maybe another 2 or 3 more days, I think, and I should be done with that. And then depending if I'm having like, you know, a bad bowel movement or something going on, you know, I probably will continue to use the bidet if I have to take a shower afterwards if I feel it's bad. But I feel like I'm getting at the tail end and finishing up with this. So I don't want to drag this video out too long. I just wanted to go over these things and let you know I get a lot of different questions online about how to take care of yourself, what to expect, people who are going to go through this surgery, you know, and I definitely try to answer all those comments and questions to give the best advice I can. But again, I am not a doctor. Listen to your doctor and whatever they say. I am not a doctor, full disclosure. These are just tips and tricks that work for my own testimony, for my own situation, that may help you. With that, ice packs are a great resource. Drink water when you're using the restroom, having bowel movements, that'll ease it. If you have a step stool, that'll also help take off pressure when you're trying to pass stool. You know, please watch some of my videos that I have out there. I will break down a lot of this stuff already as far as more details to it. I please also ask you that if you find any of the information in my videos helpful and you like what you see, that to please consider subscribing to my channel. It does help my channel. This is a do-it-yourself channel. A lot of my stuff is based on either these surgeries that I've had, fixing vehicles, various different things, solar panels, stuff like that. But hit the subscribe button to get the latest content and update on videos when I put them out. It also helps my channel, and hit that like button and the bell notification so you could get alerts on the most current and up-to-date videos. With that being said, I hope you guys enjoyed this video. I hope some of these tips that I've given you today are helpful in regards to aftercare post-surgery, using gauze, and kind of what to expect. And again, give yourself some time. It is going to take some time to heal. Expect at least a minimum of 2 months. Could be a little longer, could be slightly less depending on the person, how you take care of yourself. Stay fully hydrated. I can't emphasize that enough. Drink lots and lots and lots of water, and high fiber foods and fruits, and you know, just take care of yourself, and that'll help speed up your recovery. You want to give yourself the best recovery as possible with as minimal pain and complications. So again, with that, thanks a lot, guys. I thank you for tuning in. Please hit the like button, and we'll see you in the next video. Take care. Peace.